Hello, and welcome to the panel on preparing developing communities for a disaster. I want to first thank everyone for joining this session today. My name is Grace Kitzmiller, and I'll be the moderator for the panel. I'm currently a senior product manager for Amazon Web Services Disaster Response Program. And in my role, I focus on working backwards from the needs of organizations that are active across the disaster lifecycle to really learn about the biggest technology challenges they encounter when preparing for, responding to, or recovering from a disaster, and then exploring how AWS people, services, information, and technology can help overcome or solve those challenges. I'm so excited to be joined here today by Sarah Henley Shepard, who is the Climate Change and Resilience Senior Advisor with Mercy Corps, Tyler Radford, who's the Executive Director for Humanitarian Openstreetmaps, and Cletus Springer, who is the Director of the Department of Sustainable Development for the Organization of American States. We assembled this panel of organizations and their representatives that had a global footprint so they could share their experiences from working with developing countries on preparedness and community resilience. They also share some priorities and changes for resilience and preparedness moving forward, especially in light of COVID-19. So now we'll just take a few minutes for each panelist to introduce themselves, their organization, and just talk briefly about the communities and groups they support. So let's start with Cletus, and then we'll pass it on to Sarah and Tyler. So Cletus.
Right. Thanks very much, and good afternoon, everybody. I work with the Organization of American States, which is the oldest international organization in the world. Not many people know that, and they're always surprised when I say that the OAS predates the United Nations even. The OAS is very much like the United Nations. It has 4 pillars of interest: human rights, democracy, development, and multidimensional security. I come from the island of St. Lucia in the southwestern Caribbean, which is an island of exceptional beauty, which I would encourage everybody to visit. In the Department of Sustainable Development, disaster risk management falls to us, and we tend to approach DRM, as we call it, in a sort of integrated kind of way. Where we look at its linkages with not just other environmental parameters such as water and biodiversity and areas like that, but we also look at it in its social, economic, and environmental dimensions. I think that's a brief introduction, so I'll pass it on now.
Okay, great. Sarah.
Thanks so much. Good afternoon, fellow panelists and guests, and thank you to Amazon Web Services for hosting this panel. So as mentioned, my name is Sarah Henley Shepard. I work for Mercy Corps, which is a global team of humanitarians working together on the front lines of today's biggest crises to create a future of possibility where everyone can prosper. We're in more than 40 countries around the world with nearly 6,000 team members working side by side with people living through poverty, disaster, violent conflicts, the impacts of climate change, and now COVID-19. When it comes to disasters and humanitarian crises, Mercy Corps is there before, during, and after. We have responded to almost every major global disaster in the last 20 years, reaching millions of people with food, water, and other life-saving aid. But beyond delivering emergency supplies, we work closely with affected communities long after the crisis to ensure that they have the resources needed to build back even stronger. In many areas not yet informed through radio, television, or the internet, Mercy Corps teams are the first to reach communities with critical health and safety information. Mercy Corps takes a resilience approach to all of our humanitarian development work. We do this in order to gain a comprehensive understanding of the dynamic places in which we work so that we can secure and enhance the impacts of our relief, recovery, and development practices. While the world is facing a rapidly evolving pandemic that has affected us all, and we know in particular people fleeing conflict and living in poverty without access to healthcare, they're facing even greater risks from the COVID-19 pandemic. So we're working closely with these vulnerable people who are impacted through adapted means, which we'll talk about later in the panel, to meet both their immediate needs as well as prepare for the ongoing impacts of the economic and social shocks that may push them further into crisis. We have adapted our humanitarian development programs to incorporate public health and safety considerations for COVID-19, and we're ensuring that we're working closely with our partners and stakeholders to address COVID-19 in tandem with other program objectives. Thank you.
Great, thank you for that, Sarah. And Tyler.
Hello and very good afternoon to everyone listening in today. I'd like to invite you to imagine just for a moment, taking out your phone, opening up your favorite mapping application, and seeing your little blue dot surrounded by an entire screen filled with gray, unable to see your surroundings, any of the streets or buildings around you. This is a situation that we estimate 1 billion people in our world face, that they simply don't appear on any digital map. And as all of you on the call know, as disaster responders or as humanitarians, many of the first things we ask in disaster are the real basics. Who's been affected? Where are they? What does the situation look like? What are the needs? These questions are nearly impossible to answer if we don't have basic data like maps. And so my organization, Humanitarian Openstreetmap, is a global community of contributors around the world who are trying to solve this really basic problem, that we don't have a complete map of our world, and so many people are left out of that map. So our vision is a 3-part vision that everyone is counted and has a right to appear if they choose on the world's digital map. And the platform we use for that is OpenStreetMap, which is really similar to Wikipedia. Everybody can log in and contribute and add missing features to the map. So we want everyone to be able to participate, and we believe that the resulting map data that gets created is there to get into the hands of humanitarian responders that can use it to save and improve lives on the ground. So we work through a 3-step process. We provide our volunteers around the world, more than 200,000 of them, with satellite imagery. And you can really clearly see the homes and the buildings and the roads in that imagery. So our volunteers will trace those things to contribute to the digital map. Those results are then used by humanitarian responders to analyze situations and to respond during crisis. So really happy to be here today representing our global community.
Great, thanks everyone for that intro and that overview of your organization. Let's go ahead and dive into just a few questions, and we'll also, look to see if there are any questions we can respond to from the group that's watching this session today. The first question is really around, we hear, and I think we're all experiencing every day, the differences in, work processes, learning processes, business operations between pre and post COVID-19. Can each of you describe some of the challenges that your organizations have faced in working with communities on preparedness or resilience prior to COVID-19, and then talk about how COVID-19 has impacted your ability to provide that aid and support for community resilience? Why don't we go ahead and start with Cletus, and then Sarah and Tyler.
Right, thank you. For us in the OAS Department of Sustainable Development, we see resilience as a sort of continuing cycle of building adequate capacity within and among citizens primarily, institutions, and infrastructure to reduce the likelihood that when shocks like COVID and extreme weather shocks occur, that these shocks will not result in disasters, and that post-disaster recovery, that period is short and that it is robust. There's a perception that has lingered for a while that we have striven for many years to try to break that misconception, really, that disasters are inevitable consequences of hazard events, but they're not. The disaster only occurs when the coping capacity has been exceeded. And so if you build resilience in a manner that, first of all, reduces the impact of the event, reduces the likelihood that the disaster will occur, and if a disaster should occur, reduces the time that it will take for you to bounce back better, that we think is the whole objective of resilience building. And so the challenges that we face in our work is essentially, first of all, getting our member states and our partners to appreciate that when we speak of resilience, we speak of a culture of resilience. in addition to speaking, of course, to all the other things that go with it. What do I mean by a culture? I mean a way of life where you make resilience a way of life, first of all, of your citizens, where you institutionalize resilience, a resilience ethic in your government and private sector institutions. So these are two of the primary challenges. The third challenge is that it has always been the case that disasters have a disproportionate impact on the poor and the marginalized and the vulnerable. We're seeing this everywhere with the pandemic. And so the challenge there is to get our countries to invest in building a resilient citizenry, first and foremost. And so that will require a focus on those people who are most vulnerable, as well as focusing on the areas in which they are most vulnerable. If people are in high-risk zones, they need to be encouraged to move away from high-risk zones. The challenge there, of course, is that all of the safe areas are occupied by the well-to-do. The poor cannot move to these areas. And there's some parts of the Americas, like in the Caribbean, where there are very few safe areas that you can build in. You either have the choices you have of building on a mountain, living on a mountainside, on a slope, or living in a flood-prone valley. So, there are not many options. And so the options there for government is to reduce, to the extent possible, the vulnerable conditions in which people find themselves.
Right. That's just a really interesting perspective. And I think we don't hear often the thought that, disasters are not inevitable. It really has to do with kind of that culture of resilience. Sarah, turning over to you on the Mercy Corps side, can you talk a little bit about some of the challenges that Mercy Corps faces, and how has COVID either added to or changed your efforts to provide aid and support for community resilience?
Sure, thank you. I wholeheartedly agree with Cletus's points. The way that Mercy Corps defines resilience is the capacity of a people and systems to advance and protect long-term well-being despite shocks and stresses. Important to a definition is, well, how do you apply it in practice? So for over 7 years, we have operationalized this definition through an integrated multi-sector assessment process that informs the design of resilience building strategies in both our humanitarian and our development portfolios. And this is coupled with research and learning agendas in order to inform programming at all scales. One of the biggest challenges that we have on a day-to-day basis is humanitarian access, or accessing people in places that are experiencing conflict, protected crisis, and natural or man-made disasters. This has certainly been made much more difficult due to the pandemic, given international travel restrictions, border closures, stay-at-home orders, and the necessary public health and safety measures that are needed to keep our team members safe. So this has really changed the new normal for how we are currently adapting, designing, and delivering and managing our humanitarian and development programs. From having to pivot to remote technical and monitoring support, to ensuring that field teams have the health and safety supplies and training that they need to be protected while working with affected communities. In addition, we developed a global COVID-19 response strategy where we formed regional matrix coordination teams, as well as cross-technical pillar strategies with technical experts supporting all of our field teams, ensuring that we're focusing on 4 pillars around research and policy, cash and voucher assistance, resilient markets, WASH and behavior change communication, as well as social cohesion and public trust. So this global strategy is really targeted at transforming how we can connect with and support teams under this new normal, as well as how we engage with partners and communities across these pillars by applying a public health and resilience lens. Just a few quick examples for how we pivoted our programming and adapted to the current pandemic. We're working to ensure that household and community activities, such as convening focus groups, working with care groups, engaging in community meetings, workshops, trainings, as well as distribution of aid, are done following proper social or physical distancing, with teams incorporating critical health and safety measures. This includes adapting programs to be, program activities to be more flexible to alternate locations, such as for distribution of cash or e-vouchers, having longer time periods for collection of these goods and services, and also having diverse delivery mechanisms, such as through provision of online vouchers instead of cash. And all of this is to focus on reducing crowding, maintaining physical distancing, all while ensuring that people receive the critical goods and services that they need. And then finally, it's just really important to remember that this is a very complex and dynamic setting and situation. And so understanding that the people that we work with are already experiencing a lot of duress from climate change impacts, as well as other natural man-made shocks and stresses, we recognize that this is a long haul marathon. This is not a sprint. And so we really need to design with these communities that are most affected comprehensive strategies that enable this kind of long-term resilience building lens, as well as psychosocial support for communities and our responder team members on the front lines. Thank you.
Okay. Really interesting to hear kind of the breadth of services that Mercy Corps is providing, directly in the communities. So thank you for sharing those details. Just turning to you, Tyler, can you talk a little bit about the Humanitarian Openstreetmaps? And, how are you seeing, your ability to provide mapping activities and the availability of the resources from HOT OSM to these communities that are really working hard on preparedness, response, and resilience?
Right. So Grace, you asked about challenges, and I think one of them was very prevalent even before COVID, which is this really basic one I talked about earlier, that so many people in our world are simply left out because we don't have good data on the places they live. And when I talk about maps, you might have the perception that a map is a tool to get from point A to point B, which it can be. But in terms of disaster response and humanitarian action, maps are often so much more than that. They tell us about population distribution. They tell us about the condition of roads. They tell us about the types of medical services that may be available. So that's the basic challenge we're trying to solve. I think so I'm going to mention three of them. Number two is a perception challenge, in that when we think of life-saving humanitarian aid or disaster assistance, what comes to mind? Most often it's the things that are things like food, water, shelter, the typical or traditional life-saving sectors. But what did we find out from the Ebola outbreak in 2014 to 2016, and even the recent one in 2018 to 2019? What are we finding out from COVID? It's that information is actually is equally as valuable as those other life-saving sectors. So things like knowing who's presenting with symptoms, who's testing positive, and critically, where is that happening? It's necessary so that we can locate and contact known contacts of those who may be infected or are showing symptoms. It's key to knowing what facilities are available and where the gaps in health coverage are. So it's a massive data challenge. It's a massive epidemiological challenge, I would say. And so this is the big thing that we're faced with. The session before this one was called the future of response is now digital. And I'd wholeheartedly agree to that, in that we're trying to adapt to this world where there's been so much rhetoric around local humanitarian action. Well, guess what? It's now real. We're no longer able in many cases. Sarah mentioned humanitarian access. Well, this is not now just off the table in many cases. We can't have international staff flying into locations affected by COVID in many cases. And what we're seeing is response is getting more and more local. So it's neighbors helping neighbors, it's communities mobilizing locally, it's government partnering with community-based organizations. So we should stop saying that we prepare communities. It takes away the agency and the control and the power that communities have. And I think, Cletus, you said this well earlier. We're there to help support, and resilience is a process that communities go through, but we're only going to build resilience if communities themselves are working on it and contributing. And so back to mapping, we see OpenStreetMap and mapping as one of those avenues where communities can talk to responders and say, here's where the assets are, here's where the gaps are in my community, and here's what's missing, here's what we need. And they can do that through digital maps.
Great. Thanks, Tyler. You raised some really interesting points about, information access and just access to the communities and really working with the communities. And, really interesting to hear the feedback that you're getting from communities about, what ways, how mapping is actually helping them to better meet, to meet their needs as they're working through response and preparedness. One follow-up, just continuing down the information and data thread. Sarah and Cletus, can you talk a little bit about, how do you use information across response activities and resilience activities? And, have those information needs changed as you're looking towards either, hyper-local activities or really supporting, from a primarily virtual footprint? Sarah, maybe you want to talk first.
Sure. So at Mercy Corps, we're really focused on ensuring that learning and evidence is driving our programming and our advocacy. And that applies both to our agency strategies as well as how we work with communities, as Tyler and Cletus have mentioned, as kind of co-learning equal partners, as well as with government agencies to make informed decisions using the best access to technology, information, data, models, and maps. This is really important during COVID, obviously, because there's a lot of misinformation and rumors. So we have a lot of programming that is rolled out along with our water sanitation and hygiene programming to support social behavioral change, to help communities, households, and individuals understand what information is can be trusted. And this helps reduce incidents of conflict. It helps build social cohesion and trust, and it helps us be able to continue working with communities on ongoing humanitarian development programs amidst this pandemic. We also, of course, have robust monitoring, evaluation, and learning processes, as well as community accountability and reporting mechanisms. And these are really important to ensure that we're working closely with communities, that there is clear accountability, transparency, ownership, and equity within our programming. In addition, we recognize that we don't have all the answers. We don't have all the data. And certainly in this time of COVID, when there's so much uncertainty and still so much that isn't known about COVID and the kind of first, second, and third line impacts, we recognize that we need strategic partnerships. We need more open sharing of data, similar to what you were saying, Tyler. We need more open sharing of models and maps and reports to expedite and transform decision-making across the board. So in this way, we have several partnerships. One is with Amazon Web Services, with whom we're collaborating to build a humanitarian aid platform that allows humanitarian organizations to rapidly collect, store, integrate, and analyze data. And this helps us make near real-time decisions in really critical humanitarian contexts. This includes leveraging crisis analysis, humanitarian access teams that have access to a wide range of qualitative and quantitative data, but it's across partners. It's not just our data. And this can include satellite imagery, social media data, economic and demographic data, interviews, and so forth. So really being flexible with the type of data information that we gather and being strategic about whom we're engaging with. And then we also have a partnership with NASA, where we're working by combining our technical expertise and boots on the ground with their data reserves and information of Earth systems and disasters, and as well as their analytical capabilities. And then finally, we're also looking at enhancing access to information related to weather and climate change. And certainly this could be broadened to include understanding access to information around COVID, as well as other health issues. And the important point that I'd like to make, and this gets back to what Tyler and Cletus were saying, is that when you design or modify information systems, data, processes, tools, and platforms, they have to be user-centered throughout the design, implementation, monitoring, and adaptation. Otherwise, they're designed without communities and end users in mind. And so what we're really working to do is ensure that through these strategic partnerships, we're engaging community members, households, and individuals as co-creators to the entire process. Thank you.
Great, that was really helpful, Sarah, to see that window into how you think about and how you use data and what's important. Cletus, can you talk a little bit about how OAS uses information and data across disaster lifecycle and how you share that out with your member states? And also just if the information needs have changed as a result of COVID-19.
Right. We tend to come at data. We work more in the realm of information. We don't get down into the weeds of data necessarily. We come at the intermediate stage where the data has been tuned, because we think information is what people really need to guide their action. So in the overall context, in the overall governance context, the architecture of resilience, for us, science and geospatial intelligence are really critically important areas that require, in our view, increased investments by our governments. We don't think the investments in this space is anywhere near where it ought to be. One of the positive things that we've seen from the COVID pandemic is the growing use of geospatial data, especially for epidemiological surveillance purposes. But I think that what's needed now is a multi-purpose or multi-use system of geointelligence. And I've long felt that the foundation for that kind of architecture is the census. I think we are not using geointelligence, geospatial technologies sufficiently in the census exercise. And I think the census should be used to generate a lot of the information that we need in crisis situations like we're facing now. It is entirely possible. I mean, if you have private sector entities that can, for example, utility companies, they can tell you the age and structural status of every utility pole in their network. Why can't we do that for citizens? Why can't we calibrate where they live and their health status with decisions regarding the positioning of health centers, for example, or health facilities or hospitals? Why can't we use the location data for vulnerable people as a sounding for our emergency personnel or disaster response personnel in terms of getting who they need to get to when and how quickly, what the needs, the medical, the pharmaceutical needs of a household is if members of that household are suffering with diabetes or hypertension or heart issues and so on. So I'm talking about a system, an all-purpose, multi-purpose system of geointelligence, and I'd love to hear Tyler's views on that, because I really believe that what we need to break away from is, I mean, we will always need new information. New circumstances will generate the need for new information. But I think the earlier we can come at that with a 5-year census exercise, or even a refresher census exercise that helps us to put that data incrementally together, the more effective we will be in the decisions we make in crisis situations. And there's one other area that I'd like Tyler's feedback on when he speaks to this issue is, how do we apply geospatial technology in post-disaster assessments? You're going and you assess a bridge, the extent of the damage of the bridge. You don't just measure the damage, but you assess as well some of the structural conditions of that bridge. You take pictures of the steel and the stanchions and all of the elements of that bridge. That will inform engineers in rebuilding that bridge. They can use that information, that data, to inform the design, things of that sort. So we come at it at a very basic level, but at the same time at a very critical level as well.
Yeah, you raised some, really interesting questions around, geospatial imagery, intelligence, location of those critical resources, and even kind of having an opportunity potentially for community feedback on, what the status of those is. So, Tyler, Humanitarian Openstreetmaps has really raised the awareness of, the importance of reliable mapping, and geospatial for, to really help with that faster situational awareness and assessment that Cletus is talking about, and then furthering those feedback mechanisms. Can you talk a little bit more in response to Cletus's question and other initiatives you're hearing and seeing communities want to take on in this area?
Sure. Yeah, Cletus brings up a great point. I mean, we want to get ahead of the curve here, not be scrambling post-disaster. And the point you make around census is a really important one. And in most countries, the national census has not been linked to use of geospatial. So we have data on population, but it's not geotagged to an individual household. And there's some incredible potential there. We've had some discussions with, for example, Uganda Bureau of Statistics around trying to actually set up a geospatial enabled census moving forward. So I think it's a really, really interesting idea. Yeah, I guess on our side, related to data preparedness, one of the big programs we run alongside the American Red Cross, British Red Cross, and MSF is called Missing Maps. And the goal is to not be responsive, but to anticipate areas that are at high risk and fill in missing data in those places before disaster. And so I'd really encourage any of you listening in today, we'd love to hear what your data requests are, what your needs are, and how we can how our community can help with those. But for COVID in particular, I'll just mention a few things that our community is doing. These are response efforts, not so much preparedness efforts, but we've received 183 requests from government agencies and other NGO partners around the world related to missing map data for the COVID response. And I'll give you 3 examples. So in Peru, where our community is mapping the entire department of Cusco, Peru, and those maps are being used not for the health response, but for the economic response to provide cash transfers to families who are prevented from working due to the quarantine. In Indonesia, the second example, we're mapping every hand washing station. And for those of you who know, Indonesia is a country with more than 6,000 inhabited islands. So this is truly a situation where as hand washing stations are set up, it's not something that the data is all available in one place. It's truly a crowdsourcing effort to determine where those exist, and the multitude of government agencies and NGOs that are setting them up. And geospatial is used to understand where the gaps are, where we can place future or additional hand washing stations. Example 3 in Senegal, one of our partners, healthsites.io and OpenStreetMap Senegal, are mapping every hospital. It's around 200 hospitals in Senegal, and updating not just the location of the hospitals, but what type of emergency services are available at those locations. I mean, this is something we take for granted in the United States, but don't always have this type of data available in other countries. In Liberia, they're also our partner iLab is undertaking a similar effort. So I think the common thread between all these is that HOT is not necessarily doing everything ourselves. We're serving as a global coordination platform where communities and governments can come together and say, here's the data we need, and communities can be tasked with actually collecting that data in places where they live and work. And I think that's a really beautiful thing, is that we've seen nearly 200 of these kind of matches already happen, and really looking forward to seeing what else might be out there that we can support with.
I mean, that's amazing, the amount of outreach that you've seen so far, and the ability to fill in, with the support of communities and volunteers. It's truly amazing. Returning back to you briefly, Cletus, when you think about, the availability of the information that you are working to, engage with your member states on in building, and then also learning from the best practices of, maybe one organization off to the other. What kinds of, best practices are you seeing, not necessarily just to COVID-19, but, what kinds of information are you really seeing your members ask for? And what sort of best practices do you feel like have surfaced based on the information that's available to them today?
That's a probing question. We in the specific context of COVID, one of the things that COVID has made very, very clear is that lives and livelihoods matter. With this very stark reminder, I believe what we need most is data that will enable us to have a better understanding of the conditions that threaten people's lives and livelihoods. I've always found it to be rather intriguing that there's more information on people's electoral and consumption choices than there is on their inherent and acquired vulnerability. And I think that the only way we can build resilient countries is by building resilient citizens. So in the context of best practice, I think we are seeing our member states now give more attention to the whole notion of lives and livelihoods. We are seeing a strong attempt to focus on improving social safety nets. Granted, some of these interventions are short-term in nature, but at the same time, they point to the need for governments to really set up some firm institutionalized social safety net mechanisms that give people some measure of respite while they try to rebuild their lives. So that's a very, very strong positive. At the same time, too, there's some things that I would like to see our member states pay more attention to. And one of them is this whole notion of the interaction between humans and wildlife, for example, as a concrete step to dealing with the likelihood of more wildlife to human transmission of diseases and so on. And that is why we strongly believe in this multidimensional approach to this disaster risk management, because in the environmental context, if you're looking at biological threats, you have to pay attention to that kind of interaction. And all things like re-establishing biological corridors to allow wildlife to roam more freely without without us coming into contact with them and things of that sort. I think that is going to be we have some evidence of that that's taking place in the context of our member states in Mexico, Canada, in the United States in particular. We have some evidence of that, but we need to have a stronger focus on that area. A third area that we're seeing some very useful best practice is in the area of inclusive decision making. What we're seeing now is that governments are coming to realize that the challenges that COVID is presenting to them are beyond their capacity alone to respond. And so they're reaching out to the private sector. They're reaching out to non-governmental organizations. They're reaching out to civil society. And they're bringing them. So now we have the makings of something that was recommended way back in 1992 with the Rio Declaration. We are seeing now the emergence of inclusive multi-stakeholder decision-making mechanisms in many countries. And our hope in the OES is that these mechanisms will endure and be strengthened, and we are going to be trying our best to support that wherever we can.
Great, thank you. I think you raised some really, I think areas around community planning, preparedness, and resilience that, maybe many of us don't really think about, but, now that you're mentioning, sort of wildlife corridors and some of these others, I mean, they just make sense, right? And, so thank you for bringing those to our attention. Now, Tyler, you did mention you have seen an uptick in mapping requests and organizations that are using the Humanitarian Openstreetmap resources. Have you changed your approach at all in working as an organization or working with your volunteers? Just given this kind of surge in requests, as well as I'm anticipating a surge in volunteers as well.
Yes, we've had, just over the past few months, we've had more than 10,000 volunteers globally contribute via our platform, which is our largest response ever, surpassing the 2015 Nepal earthquake. So, we're here today talking about public-private partnerships. So I think this is probably a good time to acknowledge that. And I'd like to, Grace, thank you and AWS, because our primary tool, the Task Manager, is powered by AWS. And when we talk about public-private partnerships, this is something where we have the private sector helping us with technology development and cloud computing in this case. We have the public sector, local and national governments putting out requests for data and information via our platform. And then we have a very engaged citizenry coming in and contributing to those data, filling those data requests, spending time digitizing satellite imagery, collecting data on the ground in their countries. And we also have the private sector volunteers. Many employees of AWS and other companies are also volunteering via our platform. So, I mean, this is, to me, a fantastic example of how we can bring all sectors together for disaster preparedness and relief. I mean, so yes, there's been a huge uptick. Yes, huge demand. And it's a call to all of you listening in today. We need your help. We need your help to come map with us. Tell us what data or geospatial analysis you need. Join our volunteer community.
And I will say, we have a number of volunteers internally. I've used your mapping platform. It's so easy to use. It's so easy to get started. And, it doesn't take a really long time commitment. So if you just have half an hour or, an hour to commit, it's just super easy to, go in and get a little mapping done and pass it on to the next person. So thank you for that. I want to switch gears just a little bit and turn to access to healthcare in communities. I think some of the stresses there probably have been exacerbated with, COVID-19. So, Sarah, starting with you, how have you seen, public health actors and industry, respond in the communities and that they support or that you support? And what are, some of those tools or solutions that you're seeing being used to try to alleviate those stresses?
Sure. Well, I guess just to start with a reminder that still many people in the world don't have access to healthcare. In many instances, the only person that someone might see for healthcare might be a midwife that can come once a month, one day a month, or a few days a month. And so just understanding that still development-wise and access to healthcare-wise, we still have a long ways to go. But a few examples from our field teams in Pakistan. Normally, most cases of tuberculosis, for example, are found when people go to health facilities for other routine services. But because of the pandemic, a lot of these health facilities had to close because they couldn't meet certain guidelines, right? The burden on healthcare facilities in certain countries has been really high, and access to PPE has been really challenging. And so Mercy Corps has worked to support these facilities to make sure that they have access to this personal protective equipment. We've helped with COVID-19 screening and triage, and we've also bolstered the number of our water, sanitation, and hygiene facilities and services and products that can really help them reopen and resume their screening and surveillance. Another example from Haiti, we've been looking at responding to gaps in information and alleviating stigma around COVID-19, right? We see this with novel diseases all the time, that there's stigma and conflict that can arise as a result of cases or suspected cases. And so we've been developing a hotline or an info line that provides people with useful tips for those who are suffering from gender-based violence, as well as practical tips for parents and caregivers on how to support children during this time. And that's all packaged with COVID-19 specific health information. And this was delivered through key influencers within the communities. So again, working with communities as equal agents through the programming has been really important to the success around generating public information through local storytelling means. And then a last example could be in Iraq, our team has been providing hygiene kits packaged with social behavioral change hygiene information in IDP or internally displaced persons camps. We've reached over 19,000 people with these services, as well as water trucking. And we're working closely with community action groups to really mobilize youth and women's groups and community leaders who help really spread this information. So, just overall, the most important thing again to do, and this is a theme throughout this panel, is working hand in hand with communities to support with information control, rumor control, supporting with reducing stigma, and helping with social behavioral change and access to the resources that people need to reduce infection rates. To do this, for example, we're developing a program called Mobilizing for Health. So this is a community-led participatory approach where communities design their own programs and activities to reduce infection. They own it, they run it, and it's sustainable and equitable. And so again, seeing the role that access to information, the right information in the right language, in the right way is can't be underestimated. And it's something that we're really supporting integration across all of our programs right now.
Great, thank you. I think, what's really great about this panel is just here, I think each of the organizations that each of you supports has, a slightly different engagement process and methodology. So it's just really interesting to kind of learn, how this perspective on, resilience and preparedness can really be approached from many different angles. Cletus, turning to you a little bit on the topic of access to healthcare in communities dealing with COVID-19. What have you seen in the member state organizations that OAS works with? Are there different tools or solutions that you're seeing used more frequently, or other kinds of processes that you see being put into place by public health organizations or industry in order to help support?
Well, yes, I think one of the things that COVID has really reinforced is the importance of hemispheric organizations, regional organizations like the OES. If you consider that our member states have the limitations, obviously, the best way that they can overcome these limitations, at least in the short to medium term, is by way of some sort of pooling of their scarce resources. And in the case of the Pan American Health Organization, which is a hemispheric organization that serves the member states in the hemisphere, our member states have found a real fount of capacity, advice, data management, support for development of protocols and things of that sort. And in each region, we are seeing the benefits of regional organizations that have been set up for that purpose. In the Caribbean, for example, the Caribbean Regional Public Health Agency has been assisting with testing. It has been assisting with testing protocols. It has been assisting with the whole surveillance challenge that the region has been facing. Coming one step lower down to the sub-regional level in the Caribbean, we have an entity called the Organization of Eastern Caribbean States Commission, which has been assisting with the bulk procurement of pharmaceuticals and medical equipment, like ventilators and things of that sort. So that regionalization of healthcare, which is across the hemisphere, has been extremely, extremely helpful. But there's one point that I think I need to make, and I don't want us to gloss over it. And it's, you have these asymmetries in the whole global system, the global economy, the health economy, where the more powerful countries will dominate the markets, for certain critical health supplies and so on. And those that are, the least powerful countries are basically left to fend for themselves in that kind of situation. And so if you look at it from a global community, there's going to be the need, I think, for some kind of ethical, some kind of global ethics to emerge, to guide the behavior, to guide the conduct of the global community in a crisis situation like that. You can't help but wonder how the vaccines, for example, are going to be distributed equally among countries based on their need. If you're going to have this crab in a barrel, as we say in the Caribbean, kind of approach to health crises and pandemics of that nature. So these are all critical issues that play on our country's abilities to become resilient. And they have to be addressed. They can't be glossed over because they are really, really serious issues. I give you another example of the brain drain that has been afflicting many countries in the Caribbean, for example, in the health sector. Many of our nurses have migrated, to Europe and the United States and North America. And so we have now to fall back on countries that have surplus skills in these areas. And thankfully they have been able to respond at short notice. But these are all of the asymmetrical conditions that undermine efforts to build resilience in our global community, and we need to address them.
Yeah, I think you raised some really tough challenges, right? I think with COVID being global, some of these topic areas and sort of areas for discussion, they're not necessarily new. They're just really the visibility of the impact of these kinds of challenges becomes it just becomes just really floats to the top and becomes an area where a dialogue like an opportunity for a discussion and a dialogue like what the Chamber of Commerce Foundation has put together today, at least gives an opportunity to raise it. And then, I'm hopeful that, organizations like yours and the others on the line here will have opportunities to really try to, keep the dialogue going and not have these kinds of really important issues be forgotten. So we are almost out of time. We could probably spend another hour on those really important topics. So I'd like to give everybody just a few minutes to really share any thoughts that you have in closing. Whether they be about best practices and what you'll carry forward with you, or just some topics you'd like to leave with the audience here around community resilience and preparedness. So. Tyler, why don't we start with you, and then we'll circle out with Cletus and Sarah.
Sure. Yeah, thanks, Grace, and thanks to my co-panelists for today. Cletus, you brought up some really interesting points around equity in the supply chain, and it'd be really interesting to talk more about that. I mean, just closing out today, I guess I'll leave us with a few thoughts. One is that resilience is really a process, not an end state, and I think that's come up a few times. It takes work. And I'd like us to think about shifting from thinking about disaster affected people as passive recipients of aid and more as not equal partners, yes, but maybe even more than equal partners as the experts telling us what resources are needed, where the gaps are, and think about how can digital technologies help with some of that. And we heard a couple of promising examples on the call today. Our belief is just by involving community members and identifying the risks and assets in their communities, they, through that process, become more aware and therefore more resilient as well. And I don't think this necessarily needs to be a purely bottom-up approach or purely a top-down approach. There's been a lot of debate in the United States about how much of the response should be led nationally versus states versus localities. And I think there is actually room for both. And, we've talked about some really promising examples where we have local governments and citizens collaborating really closely together on information and data gaps. So yeah, I'll leave it at that, Grace.
Great, thank you. Sarah, do you have a few closing comments?
Sure. Yeah, also echoing thanks to everyone on this panel. I think just across some of the stories that I've shared, there's kind of several key principles or takeaways. The first is that we need to remain human and humble and empathetic with an open mind. We really need to do better about learning from and working with communities and our first responder colleagues on the front lines of COVID-19 and other humanitarian crises. These are learning labs. They are changing conditions every day. And so I think the more that, as you mentioned, Tyler, letting them take the lead and learning from and with them is critical. The second is really that we need to embrace the capacities first attitude. This is something that we've worked on in places like Cox's Bazar, Bangladesh, and post-flood Kerala, India, where instead of working with communities from a perspective of vulnerability and looking for gaps, that we start first with capacities. It sounds like a small shift, but it's fundamental to us better acknowledging and empowering working with community members that they already have a diverse and solid set of resilience capacities. They're the experts of their communities, and by committing to this kind of co-creation process and user-centered programming and policies, we can really transform how we do humanitarian aid and development to be more local, more impactful, equitable, and sustainable. Also, we need to integrate better environmental safeguarding and nature-based solutions, recognizing how intertwined and interconnected environmental health is to addressing climate change, disaster resilience, future pandemics, and broader public health and well-being. And then finally, we need to remain flexible, recognizing that there's a lot that we don't know. We need to be adaptive with our program activities, with our strategies, our partners, our budgets, our timeframes, everything. This will really help ensure that we have an enabling ecosystem where we can better pivot as the pandemic and future dynamics require. This includes leveraging partnerships to have more open forums for sharing data, information, tools, best practices, to really expedite and catalyze decision-making and positive impacts. And we also need to be good connectors and storytellers to really connect those on the front lines with each other so they can learn from each other as well. And in that kind of co-creation spirit, we can evolve together. So thanks to AWS and to all of you for exploring these issues with us.
Great, thank you so much, Sarah. Cletus, were there any last thoughts that you'd like to communicate to the group?
Yes, well, I think we are facing a crisis now unlike any that we have ever faced, certainly in my lifetime. I don't recall the entire global community being beset by a challenge of such scale. The COVID has many dimensions to it. It has the dimension of speed, scale, duration, impact, and also uncertainty. I think what is concerning most people is that they don't know what they're dealing with. And the situation changes with each passing day, and they don't know how long it's not going to last. They can't plan in this kind of crisis environment, and that's really a big challenge. Now, when you superimpose the COVID challenge, when you superimpose on that traditional challenges, like the challenge that the 2020 Atlantic hurricane season may pose, the challenge of seasonal vector-borne diseases like chikungunya and dengue and things of that sort. You see the pressures that are going to be coming at our health systems, our economic systems, our social safety systems, and so on. And it's really a huge challenge. And so, in that kind of context, I think what we need is a sort of whole of community approaches to resilience building. And I'm really pleased that the Chamber of Commerce, Amazon, and a couple of others are stepping into the game because this will require a multi-sector, multi-agency kind of approach. Each of us playing our own parts as we go forward. We saw a situation in Guatemala recently when the volcano erupted there, where we had the coffee plantations that worked at the base of that mountain, of that volcano. They had their own early warning systems and so on. But many of the farmers that worked for these coffee plantations and so on, they didn't have their own early warning systems, their own safety nets, and they're the ones who perished. And we saw a similar situation like that in Dominica, where even though the hotels were not affected, the workers, their homes were affected, their lives were affected. And so the hotels could not have reopened until the workers' situation had improved. And so I say this to say that there really is a hand-in-glove approach that is required to this. All of our futures, our predicaments, and so on are linked. And we can only address them as one community with one goal of making people's lives safer, more fulfilling, and more resilient.
Great. Thank you so much for that, Cletus. I think, I really want to thank all of our panelists for this really thoughtful discussion. I think you've raised a lot of topics that are really important, food for thought and food for action, right, moving forward. Really thank you for joining this panel today and providing, and the Chamber of Commerce Foundation for providing this opportunity to share this information. And also everyone who joined online, thank you as well for joining this virtual conference. And hearing a little bit more about preparing, developing communities for a disaster. So we wish everyone a great rest of the day and be well.
Thank you very much.
Thank you.
Bye-bye.